service and permanent secretaries that are in attendance. I also welcome our distinguished retirees, and I've seen one or two serving officers on the call. Right now, we are just 15 participants, but because of people that joined earlier, we will just go on with the session and they will join us so that we don't waste people's time. Like I said, this is another webinar session from the Office of the Head of Service, Post-Service Department. And these are first for the month of December. Our topic today is the Retirees Health Roadmap. Sorry about that, please. I was telling us about our topic for today, which is the Retirees Health Roadmap, a comprehensive guide to preventive care, screenings, and wellness. But before we start, I would like to call on the Director Post-Service Department, Mrs. Dorodola Olushola Bukola, to kindly declare the webinar open. Good morning, ma'am. Please, can you unmute? You unmute her. I'm unmuting her. I'm asking her to.
Okay. Good morning, dear participants. It's a pleasure speaking with you this morning. I want to use this opportunity to welcome each and every one of us to this webinar session today. As we have been informed by our hosts, our topic today is Retirees Health Roadmap, a guide to preventive care, screening, and wellness. As we all know, years ahead of us are golden years, even from now, and we really need to take very good care of our health. Our facilitator today will be looking at practical knowledge on preventive medicine, how we can do essential medical screening, and generally what our lifestyle should be in retirement. I want to believe that we have so much to learn this morning. So I want to encourage us, let's participate actively. If we have not already, bring out our jotters, our biros. Let's do so. We may have one or two things to put down so that we can always refer back to those things. And let me also remind us, we are live on YouTube, and that means the video will also be on the YouTube channel. So we can always go back there to refresh our memories about what we are going to learn this morning. So once again, I want to welcome each and every one of us. I want to specially recognize the members of the Association of Lagos State Retired Heads of Service and Permanent Secretaries that are already on the call. I welcome us warmly on behalf of the Head of Service and the Permanent Secretary Public Service Office, who are both unavoidably absent this morning because they are attending to some other state matters. Once again, I welcome us. And I, on that note, declare this webinar open. Thank you very much. So over to you, Mrs. Roland, please go ahead. Mrs. Roland, are you there? Please go ahead. Mrs. Roland, are you with us?
I just got connected back. I got through out. I think it's the network.
Okay.
Okay, sorry about that, please. Yes. Thank you, ma'am. Our facilitator is Dr. Olumuyiwa Yinka Balogun, and he's a medical director passionate about improving healthcare delivery and supporting patient well-being. He has a strong interest in public health and community-focused care, particularly in empowering individuals to maintain healthy lifestyles as they age. Outside clinical work, he enjoys football, music, and meaningful conversations that inspire connection and learning. Good morning, Doctor. Thank you for being here. Can you please unmute yourself? Thank you. Hello, Doctor. Can you hear me? Hello, Doctor. Dr. Muyiwa. Uh-oh. Sorry about that. I'm just okay. He's back.
No problem. Hi, good morning. Good morning, everybody.
Yeah, Doctor, good morning. Yes.
Okay,
You can
thank
go
you.
ahead, please.
All right, thank you so much for the introduction. And it's a pleasure to be here to present, preventive strategies for the general health and well-being of, everyone, but particularly this is focused towards retirees. So thank you again for the privilege to present this. And also greetings to, all retirees and the permanent secretaries and all the directors present. So just a
Good
brief
morning.
sorry, can you hear me?
Yes, you're
Yes, we can.
audible.
Please
Go
go
ahead.
ahead.
Okay, all right. Okay, thank you. So just a brief introduction to health generally. So as WHO defines it, it's a general state of physical, mental, emotional, and social well-being, and not just merely the absence of diseases or infirmities. So along the line in life, we are of course growing older, either from as a child, as a teenager, as adults to middle age to the elderly. There are different steps. There are certain health. There are certain steps we need to take towards healthy living, and it's never too late, as they say. Even if something hasn't been done in your 20s and 30s, it doesn't mean it can't start in your 40s, 50s, 60s. It doesn't mean. So, with that in mind, sorry, can we go to the next slide? Hello? The next slide. Okay, thank you. So, now there are two ways of looking at health. There's the proactive way and there's the reactive way. The proactive is more likely the preventive strategy, what you do before there's anything that happens, before you have any symptoms, before you have any pain or sickness. So those are that's the proactive way. The reactive way is waiting until you have the symptoms. When you have the pain, you have the symptoms, then you now say, okay, let me go and see the doctor. Let me find out what exactly it is. So the proactive way, it's just about doing things either by yourself or going to see a doctor just to get your regular checkups, just to be sure that your body is good, your everything is fine, and then you take the necessary steps to adjust whatever needs to be adjusted. It's just like servicing a car to prevent a breakdown, just to you don't just wait until the car has a fault before you service a car. Once you feel maybe a month or 2 months, you go to your mechanic, you get it checked out. Anything that's wrong, you get it fixed. If a tire needs changing, you change the tires. You don't wait until you have a flat tire before you go and change it. All right. So please next slide. Next slide, please. Okay, so this is just a brief summary of your master's screen schedule, things that you should be in charge of. So I would say this is weekly or monthly. I wouldn't just say it is monthly only. Um, you of course your blood pressure checks. That is, you can do it at home or your pharmacy. I would recommend though getting a machine to have at home because it's easier to check that at home than to be going to a pharmacy. Some people don't live near pharmacies and it might be a bit difficult to walk down there every day or time to time. Also, you check your weight to be sure because some of the diseases, some of the symptoms that could present could be weight loss. So being checking your weight monthly, just to be in charge, just to be ahead of it, so that once you notice anything off, you can come to a doctor, and the doctor can do some tests and then figure out whatever it is that's wrong, if that all there's anything wrong. So for your blood pressure check now, the target goal for your blood pressure should be below 140/90. The ideal one should be, between areas of 110/80, 110/70 to 120, 120/70. That would be the best, but below 140/90 is still ideal. Then annually, that is yearly, you check your fasting sugar or there's another test, it's called HbA1c. That's to check your sugar control over months. And then also your cholesterol, to do an eye exam to check for glaucoma. You go to a dentist to get your teeth checked. Then for men, okay, I didn't mention a breast exam for women also. That has to be done monthly. There are some programs as well, or there are some flyers also you could check out how to, or if you go online, you can check how to do a self-examination of your breast to check for any lumps or anything. Then for men, yearly you have to do a prostate test. Then every 2 to 5 years. For women, you have to do a mammogram. That's for women above the age of 40. Above the age of 40, you do a mammogram. Then for pap, you do a pap smear. That's to check for you do a pap smear to check for cancer. Then a bone density scan. That's within 2 to 5 years. That's when at least you have to repeat it. So the key goal of that is to prevent, is to for early detection and to prevent, any progress of any cancer or any disease. Then every 10 years, or sometimes it could be every 5 years, to a colonoscopy, you do a colonoscopy. That's yes for 40 age 45 and above. Because when you do a colonoscopy, if at all if it's clean, if it's clear, you'd you'd have to repeat it again in maybe 5 years, 5, 10 years. But if there is something, if the doctor detects something, you run it scan, and then if there's any polyp, you just to ask you to come and do it again. It doesn't mean that there's any cancer, but it's just to get ahead. It's like a screening schedule so that you're on top of everything. So this is next slide. Okay, I don't think it's showing again. But okay, so I'll start with the cardiovascular health, which is usually the silent killer because most people have no symptoms of hypertension or high blood pressure. Nobody, if you don't check, you won't know. So most people don't have any symptoms until a crisis occurs. Maybe they slump or they feel dizzy or they have this persistent headache. Then they come to the hospital and they find out that their blood pressure is very high. It is one of the leading causes of stroke and heart failure in Nigeria. And the recommendation is to buy a digital arm monitor, something that, okay, sorry, I think the screen is, okay, the screen is there now. Please, the next slide, cardiovascular health. Okay, yes, thank you. So I was saying that hypertension is a silent killer. And as I said, most people have no symptoms until something happens, and then when you check your BP, you find out that it's very high. Maybe you go to a hospital or you go to a primary healthcare center and you find out that your blood pressure is high, and they start asking, what happened? Have you that you've been your blood pressure has been high for a long time, and you're like, this is the first time I'm hearing of it. So a way to prevent all that from happening is to constantly check your blood pressure. I personally recommend at least checking it 3 times a week, either early in the morning before heading off to work, or when you get home after you are relaxed, you've eaten, you've rested, maybe shortly before going to bed. So, and a way to do that, because you can't go to the pharmacy at night or you can't go to the pharmacy very early in the morning, you can just monitor it at home by buying a digital monitor. And another reason why it's better to even buy a digital monitor, there's something called white coat hypertension or white coat syndrome. I personally have experienced it with some people. They come to the hospital, their blood pressure is very high. But when at home, they check it and then it's fine. There's nothing wrong. So it's because of anxiety, it's because of, you're afraid of maybe what might happen, you're thinking of all the possibilities. But the key is checking it when you're calm. So if at home is where you're calm, then it's best to check it at home. And the home readings give a better picture of it, because we ask if for those whose blood pressure is maybe you are not sure if it's high or not, best thing, just get a little notebook. Once you check at home, you record it on a piece of paper on your notebook. You just record it maybe Monday, Wednesday, Friday, you just check it. So at all, if there's any need, to come to the hospital and your blood pressure is high there, you can always just present the notebook to the doctor that this is my blood pressure. I've been checking it at home for a while. And so the doctor won't they won't make a wrong diagnosis and just assume that you have hypertension. Okay, so this next slide. All right. So diabetes prevention, it's another very, very common case here in Nigeria. So the key is to know your numbers. Is to know your numbers, because I still would recommend everyone to have a glucometer, particularly if you've been told that you are pre-diabetic, or even if you are diabetic and you don't have it, I would recommend you get one, because it's very essential to check your sugar level every month. Sorry, I said every day or every week if you can, because I know these things don't exactly come cheap, but health is still better than wealth. So is to check it constantly. So like for the same thing with hypertension, to record it to come, so that if at all anything brings you to the hospital, you can always show it as evidence that you've been monitoring your sugar for the past either 1 week or 2 weeks or even a month. Then the HbA1c, that's the most important test. It shows your average blood sugar over the last 3 months. It shows so that if at all you don't check your fast, if you don't have the machine, the glucometer, you can always go for the HbA1c every 3 months, particularly if it is okay. In the slide earlier, the key is to have that HbA1c below 7%. That's the key. Anything above 7%, if at all you do it and it's above 7%, you have to go to a hospital to see a doctor. Then for those who are diabetic, one of the dangers, the very extreme dangers of it, is having a diabetic foot. It could get it's a scenario where your sugar is so high that it affects your nerves, so you can't feel any sensation, particularly on your feet. So we recommend that if you're diabetic, if you're using your medications, or even if even if you're pre-diabetic, just to inspect your feet daily. You don't cut your toenails. You don't cut them very short. At least you use a nail clipper. Don't use blade or any scissors. Then use a mirror to check the soles of your feet for any cut sores. If you notice that, okay, maybe you had a cut there last week, and this week it looks like it's not healing, like there's no scar. It's still a wound. It's still open. You should come to the hospital. You should never walk barefoot. Always wear shoes, slippers around the house, anywhere it is you're going. Don't take a risk and say you want to, yeah, in your house now it's fine, but anything could happen. So those are the necessary steps you need to take just to prevent any complications. So please, the next slide. The next slide. Okay, so understanding the cancer risks. So for cancer, age is a risk factor. It's a risk factor for most cancers. It's natural. It's common. It's not tailored to a particular group, but it just means you need to be vigilant, especially as you cross the age of 50 and 60. So one of the best ways to detect it early is by screening. That's before you even have any symptom at all. Because there are different stages of cancer. There's a stage 1 to stage 4. Stage 4 being, of course, the worst. But from stage 1, once anything is found from stage 1, the survival rate are over 90%. It's easy to attack it there and there. But when it gets bad, when it gets to other stages, it's a bit more difficult. And screening is a very good prevention strategy. Another prevention strategy is your lifestyle. So between 30 to 50% of cancers, they are preventable through diet, controlling weight, and avoiding tobacco, alcohol, and certain chemicals. Okay, so I'll start with the men. So let's the next slide, please. This next slide. All right, so we'll start with men. So for men, the most common cancer in men is the prostate cancer. A screening strategy for that is the PSA, that's the prostate specific antigen blood test. It's a simple blood test. You get it within maybe within a day or two, you get the test results. So the symptoms also, men, you need to watch out for. If you find out you are going to the toilet a lot, frequently, more than what is your usual. If, for instance, you go 6 times in a day, and then you notice, I'm going 10, 12 times in a day now. That's a you need to take note of that, especially at night. If maybe you go twice at night before or once at night, you find out you're going 3, 4 times, please take note of that as well. If while urinating, you notice the urine it's not flowing as it should, or you find yourself straining to make it flow better, please take note of that. Then if you notice any blood in your urine, either once you start, either at the end of urine, please immediately go to a hospital. Okay. And please note that not these symptoms don't mean it is cancer. Please don't it's because not every symptom shows it's cancer. There's another case called benign prostate and hyperplasia. It means the prostate is enlarged, but it's not cancer. It's another common condition, but can be treated as well. But the key is to make sure you're aware of the symptoms so that you see a doctor and then you get your test, you do your test, and the necessary treatment is done. All right, so I would move on to women now. This is the next slide. Okay, so for women, I mean, the most common, the ones we see here mostly in Nigeria, the breast and cervical cancer. So for breast cancer, the gold standard is having a mammogram done. I mentioned that it's from once you're above the age of 40, it should be done every 1 to 2 years, just to check for it. And like it says here, it said you can detect lumps 2 years before you even feel it. So if it can detect it 2 years, doing it every year means you're ahead of it. So once it is seen and you see a doctor, the doctor will be able to see the scan, will be able to see the report, and know if it's something that needs to be taken out immediately, or if it's something that can just be treated, or that won't even need any intervention at all. All right, and if you're in areas where you can't have a mammogram done, what we recommend is a breast ultrasound. It's not the gold standard, but it's an alternative you can use to also do a check for your breast. So and I mentioned that earlier, the self-exam. If you have not done a mammogram or you haven't done an ultrasound, checking it yourself monthly while you're having a bath or while you're having a shower, while in the bathroom, you can just check for lumps. If you notice any discharges from the nipples, if you notice any thickening of the breasts around the area, something that is just out of the normal. Once you notice that, you come to the hospital. Excuse me. The next is a cervical cancer. It's caused by virus, human papilloma virus. It is very highly preventable. Even after menopause, it is very preventable. So the pap smears, usually we recommend them to from once you are sexually active. So usually from the age of 18 or 20, once you're sexually active, it's recommended you have it done. And it can be done once it's clear, you can have it between 2 to 5 years. You can have it, you can repeat it. Okay. So here's the next slide. Okay, so this is for the digestive health. This is for colon or intestinal cancer. So it's a very common cancer now because it's because of dietary changes. You know, I lost an uncle due to this same thing about a few years ago. And one of the best screening options is to have a colonoscopy. That's the best because that way it's an uncomfortable procedure, but it lasts for maybe 10, 15 minutes. Occasion maybe the worst case scenario, 20 minutes, and then it's done. it's uncomfortable. I won't lie to you, but once it's done, it's done. And for some doctors, they can, once they notice any growth in the intestine, they can easily remove it right there and then. They can just remove it and then that's it. But please also note, a polyp doesn't mean it's cancer, so that I don't let's not get it confused. But it removes any growth at all. Then another screening option is to do a fecal immunochemical test. It's a stool test or a fit test. The stool test that you do at home to just check for. You can do the stool test in a bottle. You put the sample in a bottle and then you take it to the lab. They'll check, and it's to just check for any hidden blood in the stool. Usually, if at all there's any stool, then if you do a stool test and then there's positive for maybe there's hidden blood, then usually the doctor will now say, okay, do a colonoscopy. Okay, so that's for screening. So the best way to even prevent it, to prevent it, it has to be your diet. It has to be your diet. So you have to focus more on eating raw veggies, as you call them. That is your vegetable, your efo, edikaikong, beans, you eat fruits especially. So you limit suya, which is roasted meat, awo, everything. Then your red meat, that is cow meat, goat meat. Those things you have to limit it. So what we recommend, you eat fish, you eat chicken without the skin of the chicken. You eat fish, you eat chicken. That's what is recommended. All right. So please, next slide. Okay. Yes. Vision. So usually, glaucoma it's common in Nigeria, and it's a very critical issue. It's it's a condition that damages the optic nerve. That's your vision. You basically it reduces your vision. So sometimes if you notice when you're looking at the maybe what you can see normally, you notice your vision is getting blurry. Even when you use glasses, you notice that I'm not seeing well. It's blurry. Maybe around the sides, you can't see very well again. Please, at that point, either you check your blood pressure or you check your sugar, because those two things they're the common causes of glaucoma. So a key fact to note is that there's no warning sign because, like I said, for hypertension, it's not you. There's no sign until you start to notice tunnel vision. That is from the side you can't see. All you can see is what is in front of you. You can't see what's by your side. So, like I said, the general thing, you can't feel the pressure. You can't feel it. You just notice your vision is getting a bit blurry, or from time to time, maybe it comes and goes. So at this point, please, you must see an eye doctor once a year at least, just to have a scan done, just to have a test done. Not opticians access your visual just they assess if you need glasses, but an ophthalmologist, he will do a scan. At least they'll be able to check for the eye pressure, they'll be able to check for any blurriness in your vision at least once a year just to do a scan. If that's not at least see an optometrist also. Okay. So next slide. So dietary tips, sorry. Eating well in Lagos State, which is even a challenge for doctors to like myself. But what we advise is to eat more fiber. That is your vegetables, ewedu, okra, bitter leaf. And what we say is if at all you are eating swallow, that's your eba, anything, make sure it's not more than the size of your fist. So that is particularly for any individual. It varies from individual to individual. You check the size of your fist, your eba must not be more than that. And once that is served, your soup has to be more than that, like more than it. It has to be way more. Not that you finish your soup and you're using the eba to you're just swallowing the eba by like it by itself. No. Let the eba even finish, let the soup even remain. Then you take the soup with spoon. That's fine. Okay, then also with proteins, like I said earlier, fresh fish, chicken without the skin, no red meat, goat meat, beef, no. Okay, then your beans, your moi moi, yes, those are fine too. But I would like to know too. I know some people have ulcer, so they can't eat beans frequently, like because it would worsen the ulcer symptoms. In that case, please then fish, your chicken, okay. Then for that's your carbohydrates, unripe plantain,
Maria, what?
ofada rice, oats, guinea corn. Those are very well recommended for you. Unripe plantain, and you could boil it.
Get to me.
Okay.
I get to me.
So what thing to limit or avoid? Salt and Maggi. Very, very, very important. Especially for those who have a high blood pressure. It's the number one enemy. So what we recommend is to use low cost beans instead, iru, or crayfish or ginger garlic for flavor. Because using a lot of Maggi, if at all you must use salt or Maggi, let it be minimal, as little as possible. Then fried food, that is your puff puff, your dodo, your sweet, even suya self. Suya should be there. Sef. Suya, any fried food, fried fish, fried meat, even fried chicken. So the recommendation is that you grill it or you boil it instead. Okay, reason being that the oil that you use there, sometimes that is if you are buying from outside. If you are making it indoors, if at all you have to, or you fry your plantain or you fry once you use the oil to fry it, please discard the oil. Don't use the oil again, because using the oil again, once the oil has been used, it becomes a bit toxic. Once it has been used, it becomes toxic. So the more you keep using it, the more toxic it becomes. So if you keep using it, it's very, very dangerous to your health. All right. So this next slide. All right. So it's called Move It to Lose It. So, being a retiree is not, it doesn't mean that if you just sit at home and just maybe watch TV or make calls. It doesn't mean that. It means it gives you a lot of time. It gives you a lot of time to do what you weren't able to do. I know working, especially working in the government or working in government facilities, you are seated most of the time. So activities, that's basically what this slide is about. Activities. Aim for 30 minutes in a day. If you can't do 5 days a week, you can do 3, 4 times in a week. So as I tell my patients, if you can just take a walk around your house or or on your street or your estate, just take a walk, 30 minutes. You'll be surprised how much that will help. It helps the bones, it helps the heart, it even helps yourself because your mood gets better. All right. So for strength, if you are still at home, you recommend simple chair squats or carrying groceries to help. It helps keep your leg muscles strong. So to prevent falls, due to bone weakness or maybe you feel a bit dizzy on your leg muscles are strong. Once you do your squats, you carry groceries from time to time. It helps. Then vitamin D. That's the morning, the first sunlight, not 3 o'clock or 12 o'clock sun, please. First light, that's the one you see around 8, 9 a.m. That one helps. Helps for your bone health. So if you want to take a walk around that time, that is fantastic. Because you have the morning sunlight, then you are moving. So it's two in one. So the next slide, please. Please, next slide. All right, so this is for mental health and cognitive wellness. So being a retiree, it's there'll be I mean, you're home, either your spouse, maybe your spouse is off at work, or both of you are home. There's nobody else. I mean, it can get a bit lonely sometimes. So research studies have shown that loneliness is as dangerous as smoking, because you're alone, you're just by yourself. It has a negative effect on the brain, which some hormones are released, and then it's it tends to affect the body as smoking tobacco does. So the important thing is to stay connected to your community, your church community, if it's the mosque, if it is uh, your if it's your neighbors, if you are going to a country club or anything, those people who you interacted with while working, keep connected with them, stay connected. You go out, you talk, you have conversations with them, you go for events, those things help. Also, sleep. Poor sleep can be linked to dementia. That is forgetting where you are, seeing things that aren't there. We recommend at least 8 hours of sleep at the very least. So that is, you go to bed, either you go to bed by 9. If you notice you're waking up, you find yourself waking up intermittently, 2, 3, you can't sleep, or you wake up by 4 and you can't go back to sleep again, please go and see a doctor. Please see a doctor, because at least there might be an underlying issue that's causing you to go to bed. To wake up early. So also we are say avoid tea or coffee after 4 p.m. because that can keep you up longer than intended. If at all you need to drink any tea, you drink the green tea, avoid coffee completely. And also keep your bedroom. Your bedroom should be dark and cool. I know it's a bit difficult with this with the light issues and the heat currently ravaging Lagos right now. But it's important, if as much as you can, keep it cool, keep it dark, because it stimulates the brain. It relaxes it relaxes the brain. It relaxes the brain to allow sleep and a restful sleep. So we also recommend brain games. That's games that encourage you to think, that encourage strategy, like chess, Ludo, IU, or you read. You just keep reading novels, books to keep your brain very, very active. All right. So the next slide. Yes. So red flags. Once you experience any of these symptoms, please you need to make it to the hospital as soon as possible. First is chest pain. Once you experience chest pain, you feel a pressure on your chest, like something is crushing you, like something is pressing down your chest, and you feel it like a squeezing kind of pain, or the pain is spreading to your arm or your jaw. Please, it could be a heart attack, it could be something else, but please make your way to the hospital as soon as possible. As soon as possible. Then these are the signs of stroke. If you notice a side of your face is drooping, or if somebody points out to you that this side of your face, that what happened to your face is looking droopy, like it's dropping a little, please go to the hospital. If you notice your left or your right arm is weaker than the other, maybe you can't raise your left arm properly, please go to the hospital. If you also notice, as well as you're talking, if you notice your speech is a bit difficult for you to talk, or your speech, people can't understand what you're saying anymore, please make it to a hospital. Those are the things that because time is of the essence, for especially for stroke. Because if you get to the hospital early enough, everything can be treated immediately, but the delay could worsen the symptoms and it could lead to further complications in the future. And lastly, if you notice any weight loss, sudden weight loss, maybe you're not even trying to lose weight, you're not taking you're not walking, you're not actively trying to lose weight, and then people start telling you, you've lost weight too, or what's happening? Are you are you gymming? Are you going to the gym that you're losing weight? It's usually a sign of an underlying illness. It could be cancer, it could be diabetes, and it could be anything. It could be a thyroid issue. And please note, this does not just mean weight loss. Also, if you notice any weight gain too, you are not actively trying to gain weight, or you notice maybe you're not eating as before, but you still find yourself gaining weight, please make your way to the hospital as well. Okay, so thank you very much for allowing me to present this. Please, do you have any questions? Any questions at all? Please send them as a chat.
All right, thank you very much, Dr. Balogun Olumuyiwa. A
Thank
very,
you.
very insightful presentation, and I've learned some new things. Thank you so very much. Everyone, thank you for still being on the call. Our topic once again is the Retirees Health Roadmap, a guide to preventive care, screenings, and wellness. So right now we've come to the questions and answer session. So please, if you have any questions, which I'm sure many of us would have, and we might have written down. Yeah, so we can raise our hands and I'll call on you, or you can drop your questions in the chat box. Okay, some people are appreciating you in the chat box now. So, okay, before then, let me just quickly take a rundown of what our facilitator talked about. I've said the topic already, and it said wellness these days is proactive. They talked about proactive and reactive, that we have to be proactive. So we shouldn't just wait until there's something wrong with us, or we are feeling uncomfortable with our bodies or our health before we go to the hospital. So you always have to maintain our bodies. Then he talked about screening schedules that we should we have the monthly schedule. We should take our blood pressure, weight, and do mammograms monthly. Then annually you can take the fasting blood sugar. Then for your eye to check for glaucoma and the dental care. So we should do that annually. Then 2 to 5 years, that will be, oh, sorry, I think I've mixed it up. Sorry, 2 to 5 years is a mammogram for women and the pap smear. Then it talked about our health, our heart. That's the cardiovascular health, which we all know that heart attack is a silent killer. So we have to be very careful. And this can cause stroke because there's usually no symptom. It happens suddenly. So we have to be careful. Then we talked about diabetes prevention and digestive health, where we have the colon cancer, which has been seen to be on the increase. So we have to change our diets, what we eat. He also mentioned the dietary tips. So we have to take more fiber, more vegetables, and not take lots of carbohydrates, which though the good carbohydrates are the unripe plantain, ofada rice, and oats, and that we should limit salt and Maggi and use more locust beans, and avoid fried foods. And he encouraged to do more boiling than frying. And as we age, we should walk more, do more strength training, and build our muscles, because there will definitely be a loss of muscle strength. And he also advised to be out so that our bones can get the first sunlight of the day. Thank you for that. I've never heard that before. So we should get the first sunlight of the day because it helps with our bone density. All right. Then he advised to have 8 hours of sleep, which is essential, and the lack of enough sleep is linked to dementia, and we should avoid taking tea or coffee by 4 p.m. and try not to be alone. Don't be isolated. Stay connected to people, learn new skills, and he mentioned the red flags, which once we once we notice chest pain, stroke signs, or sudden weight loss, we should please see a doctor immediately. So, yes, that's what he mentioned. So please, if you have any questions, like I said, kindly raise your hand and you'll be called upon, or leave your question in the chat box. Or if anybody has any contribution to give. Okay.
Okay.
Doctor, there's
Thank
a
you. Yeah.
question here. Someone said, okay, yesterday. All right. Thank you so much, Doctor, for the wonderful presentation. A lot of these tests are not covered. Oh, okay, that's not for you, but anyway, I think it's just an observation. A lot of these tests are not covered in Ilera Eco. A simple lipids profile. Oh, sorry about that. Okay, that's
I
not for
can,
you, doctor, but
no problem. I can see
we've
some other
noted that.
questions.
Okay.
Can I answer the
Um,
questions I've seen?
yes. Please go ahead. Please go ahead.
All right. Okay, so the first question I can see here is the random ratings for blood pressure for 60 and above. Okay, so the key about blood pressure is that there's no one particular value that is okay, it must be this. But anything, if you're on any medication, if you're on any blood pressure medication already, your blood pressure should be below 130/80. If you're on any blood pressure medication, it should be below 130/80. If you are not on blood pressure medication, that 130/80, I mean, it should still be below, but if it is above that, but below 140/90, it's a warning sign for you. It doesn't mean you are hypertensive, but it's a warning sign. So it just means to be watchful and to be very careful, either the stress, your salt into your diet, the stress level, and your lack of sleep. So those are the things to take note of. But the ratings, generally, I would just say below 130/80. Just once it's below that, then it's a very healthy blood pressure. Then I see a question for how do you prevent arthritis, particularly in the knees?
Yeah.
Arthritis preventable? Is it? So yes, arthritis is one of the things that can occur with age. As you get older, you tend to notice you are feeling a bit more pains, and the usual sites are the shoulders or the knees. Those are the two most common areas because those are the one of the two they move a lot. You have to use them a lot. So yes, there are ways you can prevent it. The ways to prevent it, like I said, is for the movement, actively walking. Actively walking. The reason why arthritis comes up is sometimes it's age. Sometimes it's age. There's nothing that can really be done about it. And there's some other times it's just lack of movement. If you don't move your body, it's like if you don't, if you have a car and you don't use the car for a month, by the time you use it, there'll be some faults. Either the pressure in the tire has gone down or something. So that's just how it is. So movement, either those simple squats, simple chair squats, moving around, just taking walks. Those things improve. They improve the knee pain. Okay. So there's one that says if you are visiting the toilet 4 times and the sugar is fine. Sorry, I didn't. Okay. Um, and the sugar is fine, and the random was one. What can be the issue? If you are going to the toilet, it doesn't mean it's not likely a sugar issue. I don't know if it's a man or a woman, but what I would recommend is to go to see a doctor immediately, because if it's a man, you might have to do a prostate test to be sure of what it is, and then also if it's a lady, or it could happen to men or women, to the amount of water you take. If you take a lot of water before going to bed, it's very
Hello,
common that
doctor.
it's very normal that you go to the toilet. Yes, sorry, I lost it.
Oh, okay. Can you please take that again?
I was saying that if hello, sorry, can you hear me? Hello, hello.
Yes, we can. Please go ahead.
All right, I was saying if you consume a lot of water before going to bed, it's very normal that you go to the toilet. Well, because your body will, at that point, your body is trying to rest. So any water, anything that comes, it's going to want to get rid of any waste product. Your kidneys and everything. So definitely you go to the toilet. But if you're still going to the toilet 4 times a night when it's not normal, either you're a man or a woman, please just go and see a doctor. All right. It could be an electrolyte issue. It could be water. It could be prostate. It could be anything. But the best way to be sure is to go and see a doctor. All right. So, is there any other question? Okay, your question is on that BP. You understand age is related to the measure. That age with the pressure, no, the pressure cannot be that high. If it is 150, 90, no matter how old you are, it's not good. It's not good. If 150, 90, if I say 150, 90, I'm most likely going to assume that it's a child, because yes, children, they have faster heart rates and their blood pressure might be a bit higher, but with age, the pressure, no pressure can be as high as 150, 90. It's very dangerous for any age at all. Even in your 20s, 150, 90 is not safe. Okay, I'm seeing one about how do you measure number
Sorry
of,
to interrupt. There's
yes.
someone that has raised their hand for a while. Madam
Okay,
Fati Nukunlupumi. Please, can you go ahead, ma?
okay.
Uh, Thank you very much.
Yes,
Doctor, we thank you for the lecture you have given us. It's well taken and it's very, very helpful. My
thank
questions
you,
are
ma'am.
in twofold. I've discovered that we need to eat a lot of sweet potato, beetroot, and lentil to strengthen our legs. Do you understand? And I've been trying to
Okay,
follow that uh, remedy. Do you understand? But that lentil is difficult to get. So what is that lentil? Because I've gone into deeper market, I've gone into stores, I've not seen them selling the lentils. Then the second thing I want to ask, if you have leg issues and you are eating sweet potato and you are diabetic, does it have any adverse impact on somebody that is diabetic? Those are the two questions I want to ask. Thank you very much.
okay. Thank you very much, ma. All right. So, sweet potatoes, lentil is like it's from the same family as beans. It's from the same family as beans. It's like it's nutritious. It has protein. It has all these minerals and fibers. It's perfect for stews and everything. But if I mean, it's not so common here in Nigeria. It's also common in Nigeria, so I understand the lesson. But what you could get chia seeds or pumpkin seeds. Those are good alternatives you can have to lentils.
Pumpkin what,
It's
please?
pumpkin seeds,
Pumpkin seed. Okay.
and chia seeds. That's CHIE.
Yeah.
Yes, Kia.
Okay.
Yes. Then also the question you asked about sweet potato. Sweet potato, because of the name, please don't be listen, it doesn't mean that it doesn't have as much sugar as you think. It's just because it has I don't know, it was named because it has a sweeter taste compared to Irish potatoes. But
Okay.
it has a lot of antioxidants that are very beneficial, vitamins, so it's perfect. It doesn't affect your sugar, and it's a very it's preferred to Irish potatoes in all ages. It doesn't
Okay.
have anything to do with the sugar.
Thank you very much, sir.
You're welcome, man. Okay, so let me see. I can't remember where I stopped. I think okay, someone asked about minimum hours of sleep. How do you measure number of hours? Okay, to have a minimum of 8. Okay, so it's just about you can just look the time you are going to bed. You might not be able to get an accurate this is like okay maybe 9 because you won't know the exact time you go to sleep because you can go to sleep by 9:26 or even 10:11. You won't know. So the key is okay, the time you are going to bed, around that time you are going to bed, just look at the time. The key is also, yes, I didn't mention that, but also leave your devices, keep them far away from you as you can, because yes, sometimes they can be very distracting. At that time, maybe somebody sends a message or you might get a notification, so you'll be tempted to look at it, and that can keep you up. So it's to keep it as far away from you, keep your room dark. So yes, as I was saying, once you check the time, that's from 10, or let's just say 10:30, you sleep off. If you wake up, you check the time maybe before you go to sleep. At least I do it sometimes. If I wake up, I'll just check the time like okay, this is 3 o'clock or around 3 past 3. So you'll be able to calculate that okay, I went to bed 10:30. So this is like almost 5 hours. That's the way to measure it. And you said you woke up to urinate like 3, 4 times a day. So the question you should ask yourself is it norm? Is it how you've been going to the toilet normally? If it is, then there's nothing wrong. If it's how it has been, then that's fine. If it is abnormal, then you have to ask, are you drinking too much water? Or did you take coffee too? That's another reason we say don't take coffee. Because coffee makes you go to the toilet a lot more. So if you take coffee, there's a guarantee you go to the toilet and it will disturb your sleep. So you have to look at, do you take coffee? These are the questions you need to ask yourself. Then if the answer to both those questions, no, then please just go to the hospital so that any further questions, doctor will ask, and if there's any need for any test. Um, okay. So I use ginger, garlic, glucose beans. We also change to sea salt and mountain salt. Well, the thing about sea salt, the thing about sea salt, yeah, it's I don't know let me see if I can explain it in um it's from it has minerals, yes, which is no good. It has a milder taste, but the thing about salt is it has um potassium, it has sodium. Sodium is the key thing. So if the key that's the key because if your sodium is raised, um sodium and chloride, those are the things that usually constitute salt. That's the key. So it's not about the table salt, sea salt kind of thing. Those things, the content, the minerals inside, when you take it, it can raise your blood pressure. So it's advisable to lay off salt in general or spices, or Maggi rather, because those things have a high sodium content, which can raise your blood pressure. Okay. I hope that's the question. So okay, the stiffness, Mrs. Roland. Okay, so sorry, said what can be causing some stiffness at the knuckles and how can it be managed or eliminated? Okay, yeah, okay, that's the joint. Yes, that's a very common question, a common complaint. Usually, it is because of it could be arthritis as well, but the key is to be managed. How can it be managed? Is exercise also. Exercise, and then there are some vitamins you can take. I would not say the name here because it's best to go to the hospital so you get the name. I don't want to be prescribing medications online here. So But there are some vitamins that are particularly tailored because the stiffness is very common. So it's about exercises and vitamins. Either you take fruits, you take vegetables, or there are some particular vitamins that are tailored to that stiffness to help with that. Okay. Is that right that anyone that has a partial stroke should not be taken to the hospital because injection will worsen it? No, it's not right. And there's a point of correction. It's a stroke. There's nothing about a partial or total stroke. A stroke is a stroke. So once there's a stroke, the key is to go to the hospital as soon as possible. Okay. It's very injection. The doctors will not give. Doctors are not supposed to give injection that will worsen anything. The key to all the drugs or any injections they give is to lower the blood pressure so that the person can get better, and it's to help help the person regain function again. All right. So what are the causes of cramps in the leg? Yes, that one is caused by is numbness. So if you are seated in one place for so long, and then you stand, that's usually how people get the paja, the cramps. But usually what happens is there's a loss of blood flow to that particular to the leg. So it could be the way you are sitting, or it could be the fact that you're sitting for too long. So those two things. So that's why we recommend even while at work, if you're sitting down, even at home, if you're sitting down for too long, stand up, move around, let blood flow come to the legs, let it return to the legs. Don't sit down for too long. Always take breaks to stand up and move around. Those things will help with the cramps. Uh, okay, Mr. Samuel said, will injection be given to patients? No, drugs will be given. Injection should, how do I put it? There are some drugs that are given via the vein where they have to put a line and then give you some drugs. I wouldn't call those things injections. There are some cases that might because you have to understand the the situation because there are different people could be there are different types of stroke. Okay. So but generally to the best of my knowledge, injections no. Be given to patients suffering from stroke? No. What they are giving is medication through an IV, through the vein and IV access. It's not something that you just put the needle in and give you. To the best of my knowledge and to the best of my experience in my practice, no, I haven't seen anything given. Okay. I hope that answers everyone's questions, but I don't think I've seen any more, unless I've missed any.
Okay. Thank you for answering all those questions, Doctor. I'm not sure if anyone has more questions, but I'd like to call on our Director for Service Department to please add some few words to the presentation, ma'am. Thank you.
Okay. Thank you very much, Mrs. Roland. And let me also express my appreciation to Dr. Olumuyiwa for a very insightful presentation. And I want to believe that all participants have one thing or the other to learn from this presentation, even though we are used to some of, those things. I want to believe we have learned something as a takeaway. For me, my own takeaway is a red flag, you know. He mentioned three things to us that are really very important. I want to start having pressure on the chest, it's squeezing, it's spreading to the arm, is probably a sign of an heart attack, and something should be done immediately. The second one he mentioned is the sign of stroke, the face dropping, the arms weakness, and so on and so forth. And then the third one is the weight loss. Either one is suddenly losing weight, or one is getting bigger for no reason. Let's pay attention to those red flags. And I want to believe that as we do our routine checks and we change our lifestyle, ensuring that we move, not sitting down in a single place. Let's move, let's exercise, and then let's pay attention to our diet. We have been told so much. Let us stick to the recommended, lifestyle. And I think those two things are very key, at this age for us. Are ensuring that we exercise and we pay attention to our diet. So at this time, very, very important. So once again, I want to say thank you to our facilitator and all our retirees on this call this morning. I want to believe that our host, Mrs. Roland, has already enabled the system for all of us to be able to say something. But before we do that, I would like to, on this note, declare this webinar closed, and then let Mrs. Roland stop sharing the slides, because we have come to the end of the webinar. But we want to also interact, because that is part of the way that we connect. So, Mrs. Roland, can you please stop sharing the screen? And then I want to encourage our participants. Let us keep our videos open so that we can see each other's faces and so that we can exchange pleasantries. I can see Mrs. Odugua. Good morning, ma. It's a pleasure having you on this call. I think I earlier saw Mr. Sanot. Good morning, sir. I can see that Mr. Abirugu is here. I greet you, sir. Mrs. Simpson.
Good morning, Mrs. Durojola. How are you?
I'm fine, thank you very much.
Thank you for always being there for us. So God bless you.
Amen. Thank
You
you,
are
ma.
highly appreciated, my dear.
Thank you. Mr. Osho,
My
all
sister.
the way from Okeokun.
Thank you.
Good to see you.
Thank you so much, my sister.
Sir.
Káàárọ̀, my sister.
Okay, I can see Dr. Gbenga Alao. Wọ́n ń ṣe medical doctor. Medical doctor, PhD ní tiwọn. Wọ́n kàyé wọ́n rẹpẹtẹ.
That's right, doctor.
Good to see you, sir. Thanks for joining.
Yes, ma'am.
We are
I'm
grateful.
here.
I can see Mrs. Ogumola is also here. Good to see you. Oh, Mr. Daudu, ẹ káàárọ̀, sir. Mrs. Adekanye, good morning.
Good morning, no.
Ma.
Well done.
Thank you, ma.
Good morning, ma.
Yes, ma.
Thank you
Mo ní
so
pé
much.
Mrs. Adekanye méjèèjì náà wà níbí o. Ẹ káàárọ̀, ma. So,
Ẹ káàárọ̀. Ẹ
yes,
ṣeun
ma.
wa ilé ń kọ́ o. Ẹ kú tọ́jú wa
Àlàáfíà ni, ma.
dúpẹ́ o.
I can see that Mrs. Adelaja is here too. Good to see you, ma. And Mr. Adegbeson, latest retiree. Good to see you on this call. Thanks for joining.
Yes, ma'am.
Okay,
Good morning,
I can see Mrs. Cholarin too. Ẹ káàárọ̀ ma. Good to have you on this call, Mrs. Adesanya. We can please exchange pleasantries. Ẹ jẹ́ ká kíra wa o. Àwọn èèyàn kan tí ẹ ṣí fídíò ni o. Ẹ jẹ́ ká ṣí fídíò.
Thank you, ma.
It's about connecting with each other. It's all part of wellness.
Good morning, ma. Good morning,
Good
our
morning,
there, Mrs. Ogunmola and the rest.
Good morning.
Erasa.
Kuya is saying good morning to everyone. Good morning.
Good morning, ma.
Good morning, Mrs. Kuye. Good to see you.
Yes, ma.
I'm sending my message. Good morning. Thank you very much. We really appreciate you, ma.
Mrs. Simpson,
Eshema. Thank you.
Okay, ma. Eshema.
Sure.
Yes, ma. It is well.
Mrs. Orenaya, my sister, I can see you.
It is well with you. I can see you. Thank you very much.
I can see you. Good morning.
Good morning, my sister. We really enjoyed this program. Educative and very, very interesting.
Yes, so Anisha that will give us an enablement to go over and do it. Lagos State onínáwó àìsàn lé wa lórí adẹ ní kí wọ́n wá gba ìsàn
lápá ọ̀dọ̀. Mr. Daudu. Mo rójú yín sá o. Ẹ káàárọ̀ sá.
Bye-bye.
Thank you, ma.
Good morning, ma princess. I can see ọmọọba. Ẹ káàárọ̀ ma o. Good to have you on this call. Okay, thank you all for joining. So we are ending the meeting now until the next 2 weeks. A kú palẹ̀mọ́ ọdún o, á bá wa láyọ̀. Bye.
All right, ma. Thank you, ma.